whether directly or indirectly. Our day-to-day activities have been affected, jobs have been lost, and livelihoods disrupted. We are aware that it has not been easy for all of us, and as a government, we have been concerned and have introduced interventions to alleviate the sufferings of our people and measures to limit the spread of this virus. You do recall that our initial responses were aimed at curbing the importation of the virus. We even suspended international flights, and to a large extent, we succeeded in this objective. I'm sure you're all aware our mandatory quarantine has been one of the successes in terms of curbing this virus. However, due to the nature of human interaction, it was not possible to keep the virus from crossing the border. No country has been able to achieve this, and therefore the objective later transformed into combating the virus in our communities, because that is where transmission has been established. And to a large extent, we are succeeding in this objective. We would like to thank all our able surveillance teams and healthcare workers, as well as the multi-agency teams that have come forth to combat the virus within our communities. They have identified high-risk areas, and we've been able to share with you these high-risk areas in our daily briefings. And they've also aggressively undertook contact tracing, which is a key element in defeating the virus, and we've improved our testing capacities and treatment. These efforts have significantly contributed to the current flattening of the curve in the country. Now, fellow Kenyans, our porous borders are the ones that have become the latest high-risk areas in the transmission of the disease. And the borders are now our key area of focus. On Tuesday, we informed you of a technical team that was sent to Namanga border on a fact-finding mission. The objective of this team was to assess the situation and to recommend interventions, particularly for truck drivers who are now becoming another weak link in the fight against the virus. And in our daily updates, we have informed you of the cases that continue to come from our border points, particularly Namanga. Yesterday, as you're all aware, we recorded 47 new cases, 22 of them being Kenyans, while the remaining 23 were Tanzanian nationals. At another border point of Isebania, Migori County, we continue to witness emerging positive cases. The government is closely monitoring these developments and putting in place interventions. We are aware that many Kenyans have been voicing concerns regarding these emerging trends at our borders and the porosity at our borders. We wish to inform you, as members of the East African community, we are in constant discussion with member states on how best this matter can be handled for the safety and well-being of our communities. The National Emergency Response Committee is closely monitoring this situation and will be able to escalate any measures that would be required. We therefore wish to urge Kenyans to remain calm and to exercise patience as the government addresses this situation. We do appeal to our communities living within and around our border counties to actively exercise the Nyumba Kumi community policing. We should be vigilant, and we should report any suspicious individuals who may use panya routes to get into the country. Turning to our situation as pertains to the COVID-19 pandemic, we have tested 1,486 samples in the last 24 hours, bringing to total the number of samples tested to 36,918. And from the samples tested today, 21 people have tested positive for COVID-19 disease. And all these 21 are Kenyans. The youngest is 7 years old, whereas the oldest is 79 years old. 14 are male and 7 are female. And 4 out of this number are truck drivers who are tested at the Namanga border. Out of the same samples, 8 individuals were truck drivers from Tanzania who also tested positive and were referred back to Tanzania. 7 at the Namanga border and 1 at Isebania border. The 21 Kenyan cases are distributed as follows: 12 cases from Mombasa, 4 from Kajiado, 4 from Nairobi, 1 from Uasin Gishu. And therefore, this brings the total number of those who've tested positive in the country to 758. The positive cases are also spread out in the estates as follows. In Mombasa, Likoni has 5 cases, Mvita 4 cases, Jomvu 2 cases, and Nyali 1 case. And in Kajiado, 3 are from the Namanga border point and 1 from Loitoktok. And in Nairobi, 4 of the cases are distributed between Isili and Kibra, with each having 2, while Uasin Gishu has 1 case from Tarbo. Today, we have discharged 3 people from hospital, and this brings to number 284 the total number of recoveries from COVID-19. And we do thank our healthcare workers for this achievement. However, on a sad note, we have lost another 2 patients, both from Nairobi County, and this brings to 42 the total number of those who have so far lost their lives from the disease. And we would like to send our heartfelt condolences to the bereaved families and friends. As we conclude, we would take this opportunity to thank all those who have provided different kinds of support to the Ministry of Health in response to this pandemic, and we encourage other well-wishers to continue extending their support. And aligned to this today, we do have a team from World Vision who will be presenting to us a number of PPEs as part of their support towards COVID-19 response. Before we get to that session, I think we'll invite questions.
Just like the HIV virus, do we have any measures or talks to get back to normal, because the UN body has said that the virus is going to stay for longer? And if not, what's the seriousness of this pandemic? If it's out of control again, are we looking at more measures that the government is going to take?
From NTV. So today we also had a press briefing from a section of health workers who've reiterated their intention to go on with a strike that is on 18th of May, that's on Monday next week, saying the government has not addressed some of the issues that they addressed with regards to provision of PPEs as well as the stimulus package for them. So kindly, if you can address some of these issues that they have raised in order to probably stop the health workers' strike on Monday.
My name is Shamtai Goin from Citizen TV. Following the death reported in Bomet yesterday, could you kindly let us know if you've started contact tracing in Nairobi, because the patient originated from Nairobi before going to Bomet? And then the last question is, has the initiative to have those placed on mandatory quarantine and not pay fees started taking effect? There are claims that some who are in KMTC who arrived from China have been told that they have to pay before they leave. That is when the 14 days lapse.
Thank you. Thank you. I think I'll take those questions. And I'll start with the first one from Purity Museo. Indeed, we did listen to the briefing from the DG WHO yesterday concerning this virus, and his emphasis that the virus is here with us and bound to be with us for a long time. And according to our experts and scientists who are also doing modeling, that this picture remains true. Indeed, this virus may be with us for a long time to come, and therefore it requires us, 1, to maintain our current containment measures, and to ensure that, 2, we can actually chart a way forward as to how we are able to actually live with corona. I'm sure you've seen different countries are putting in play interventions as to how they can continue with a new normal, because it will never be back to the olden days. This is a new normal, and therefore the same measures are being evaluated within the country. How do we maintain continuity of business while ensuring that we have social and physical distancing measures, and that we are actually able to prevent the rising cases of coronavirus? So there are measures in play. And perhaps I'd like to remind us all, there was once upon a time in the 1980s where we were struggling with HIV. And HIV had afflicted our country, HIV had afflicted the globe. But we were soon able to learn how to mitigate this and how to live with HIV and to live positively and to actually flourish. And we shall do the same. What we need is your cooperation in maintaining the containment measures, in adhering to the simple measures of hand washing, of masking, and physical distancing. And indeed, different countries are all on a journey plotting how the new normal will look like, and Kenya is doing the same. With regard to the strike of healthcare workers, again, the ministry is alive and is in discussions with different healthcare worker groups as to how this can be averted. And let me reiterate by saying, and we've said it over and over again, healthcare workers are basically the heartbeat of this response. And so we are in negotiations and discussions with them to evaluate their concerns and to be able to come to a middle ground where we can actually move forward with this. And as we do this, one of the issues that we are addressing is actually PPEs. And that's why we have 2 trucks right next to us today that are here to bring together some almost 11,000 sets of PPEs that will protect our healthcare workers. All other grievances on the table are being discussed, and we're in negotiation to avert any strike on Monday. With regard to the issue of Bomet that was announced yesterday, I think even from Bomet County itself, the governor was able to emphasize the need for contact tracing, and the county, together with the national government, have actually embarked on a contact tracing agenda. The last 2 briefings, we were able to share with you the importance of contact tracing and how robust our mechanisms of contact tracing are, even to the point of being able to, identify that the person had actually transited through Nairobi. And so at this point, I will ask the DG to give more information to the gains we've made in terms of contact tracing for this individual.
Thanks, Madam CS. Indeed, we have made significant progress in contact tracing, and we can be able to map many of the cases to primary contacts, secondary contacts, and even tertiary contacts. For this particular case of Bomet, we have a very clear pathway that we are following. This individual actually went to a clinic that is in our know, in Toi Market, and we have moved with speed to be able to round up the people who actually attended to this individual. But we're also in constant discussion with the team in Bomet to also scale up the contact tracing at the county level. So we are confident that we'll be able to follow a specific trail of contacts, and everybody who came into contact with the deceased will be in our radar, and we'll be able to deal with them in quarantine and isolation after testing appropriately. But just also to add, in terms of Purity's question, yes, the virus is likely to be endemic going forward. As Madam CS has said, we'll have to adapt our lives with the virus in consideration. So we'll need to continue the simple measures that we have always discussed. And of course, the lifting of the restrictions that are in place will be gradual, based on science, based on information that we receive from our colleagues in modeling. Remember, countries that have gone ahead to be able to lift restrictions, and within 3-4 days, there's an upsurge in numbers, and then they have to claw back on the restrictions that they had placed earlier. It is best to be able to study this so that when you make a measure, you make it moving forward. So our appeal is to Kenyan people to continue the hand washing, continue the use of sanitizers, the use of your masks. If we can be able to flatten our curve, then there will be no reason whatsoever to continue with the restriction movements. For the healthcare workers, of course, we are working on a comprehensive package for all the healthcare workers without discrimination of any particular cadre. And we'll continue to dialogue with the unions so that we can be able to reach an amicable solution. But we also want to thank them that despite these difficulties, they have continued to serve the people of Kenya with dedication and patriotism. In terms of the quarantine facilities, you remember Waziri gave his word here during the press that quarantine in government-designated facilities is free, and that directive is being implemented to the letter. Please, if you hear of any facility where somebody is charging or levying a fee, bring it to our attention so that we can be able to address it conclusively. Thank you.
Thank you, Bwana DG. I think at this juncture, I'd like to invite the Vice President from World Vision to make a quick remark, and he'll then invite the Country Director. Karibu.
Thank you, Madam CS and DG. We as World Vision Fraternity, and in particular World Vision Kenya, are grateful to be here today with the government, accompany the government in the response initiative for this terrible scourge. Before I go to the items that we wish to hand over to the government, I just want to say two things. The first is that we are in solidarity with the government in terms of all the preventive measures that have been put in place to combat this scourge. We appeal to all the citizens in the country to heed to those instructions because it will save lives. The second part is on the issue of domestic violence that we see in many parts, even though isolated, but the concern of some elements of domestic violence, especially on children, that is disturbing, and especially also mothers. So we are calling upon the Kenyan fraternity and the community at large that please let us protect ourselves, our neighbors, our families, the communities at large. Please let us protect the children and the mothers and all the vulnerable communities in the country at this time that we are putting into practice social distancing and all the other measures that have been put in place. Let us not take advantage and start abusing children and people who are in need. So that is absolutely critical. But I wanted to say, Madam Kaz, that the level of partnership that we have with the government of Kenya is untested. We are grateful for the partnership as World Vision Fraternity, and we continue to accompany the government and the people of this country to combat this scourge. So thank you very much for this partnership. We are holding hands together, and together we shall conquer this scourge. At this point, allow me to invite the National Director for World Vision Kenya to say a few remarks, and will tell us exactly what level of contribution we are making today to the government and to the Minister of Health to help in the fight of this scourge. So Lilian Dozo is our National Director for Kenya. My name is Stephen Omola, as the Vice President of World Vision in East Africa region. So Lilian Dozo, please, you're welcome.
Thank you.
Thank you very much, Stephen. Madam CS, thank you so much for this opportunity. First of all, I'd like to commend and applaud the government of Kenya, and through you, the Ministry of Health, for the commendable efforts that are underway to really combat this scourge of COVID-19. I'd like you to know, Madam CS, that you have a strong and strategic partner in World Vision Kenya. We'd like to affirm our commitment to continue working and partnering with the government in this fight against COVID-19. And it's a fight that we believe will be won as we see the great efforts that are underway. To this effect, World Vision Kenya has today donated 11,416 PPEs, which are worth over 50 million Kenya shillings, to the National COVID-19 Emergency Response Committee. This is really our way of supporting all the efforts that the government of Kenya has put in place. And the kits comprise of surgical masks, shoe covers, scrub bottoms, aprons, and coveralls. It is our hope that this equipment will really go towards this morning for all the wonderful work that they are doing to protect Kenyans. At the county level, CS, World Vision has already dispatched PPEs to the tune of 52 million Kenya shillings in total. And we continue to partner with counties to make sure that we also contribute towards their efforts towards combating COVID-19. As you know, CS, World Vision is present in 37 counties out of the 47 in Kenya. We are a community-based, child-focused organization that seeks to ensure the well-being of vulnerable communities with a special focus on children. So aside from the support offered to the health sector, World Vision is also working to lessen the impact of COVID-19 amongst vulnerable children and families through the provision of cash transfers that can be used to buy food and other essential items. We all know that there are so many communities that have been impacted by COVID-19 and their incomes have been eroded. So this effort to embark on cash transfers is aimed at ensuring that we help to alleviate that suffering. Most importantly, We are keen, CS, on working with the government and other key stakeholders to protect children from abuse or violations of their rights, especially during this COVID-19 pandemic. We've all read reports that domestic abuse and especially violence on children is on the rise. So we continue to support awareness creation to make sure that children are protected. And we'd like to request the National COVID-19 Emergency Response Committee to consider developing specific COVID-19 child protection standards of operating procedures that integrate child safeguarding guidelines. I thank you, Honorable CS, for this opportunity.
Thank you, Madam County Director. And I think the NERC and the Ministry of Health do take very big notice, one, of your strategic partnership, and two, of our call to action to pay attention to domestic abuse, and especially in safeguarding our children. And so we shall endeavor to do this. The DG is here and his team, and I'm sure they will work on the required protocols. I think now I'd invite the DG to receive this, and we can have a picture session.
Deploy this in videos in our hotspots to ensure protection.
Thank you so much. Santeni Sana, Vice President and County Director. Thank you.
We look forward to working beyond COVID.
Right.
And the red line is impossible. Thank you.
Thank you. We can give our cards for the phone.
We can shake hands.
Thank you so much.
Hamjambo wa Kenya wenzangu, mimi ni prosecutor. Niko hapa kusisitiza maagizo ambayo tunapewa na Wizara ya Afya kuhusu ugonjwa wa coronavirus. Tunaambiwa